In this video, you will come to know about the risk factors and complications of high and low blood pressure. Risk factors of high blood pressure. A very common risk factor of high blood pressure is obesity or overweight. Being overweight puts additional stress on your heart and circulatory system, which can lead to major health issues. The chance of developing diabetes, high blood pressure, and cardiovascular disease is also increased. And here is the biggest risk factor of high blood pressure, and it's actually an unhealthy diet rich in sodium. As you know that your health totally depends on the food that you are taking. Your health depends on getting a variety of nutrients from different sources. High blood pressure is a further danger associated with a diet high in calories, saturated and trans fats, sugar and salt. So, making good eating choices on the other hand can actually help lower your blood pressure. Lack of exercise is another risk factor of high blood pressure. If you don't engage in adequate exercise as part of your lifestyle, you are more likely to develop high blood pressure. Excess alcohol. Consuming excessive amounts of alcohol regularly can lead to heart failure, strokes, and irregular heartbeats, among other health issues, arrhythmias. It can significantly raise blood pressure, as well as your risk of developing cancer, being overweight, abusing alcohol, committing suicide, and getting into accidents. Another risk factor of high blood pressure is stress. High stress levels can cause a brief but significant rise in blood pressure. By increasing your intake, smoking, or drinking alcohol while trying to unwind, you can only make your high blood pressure issues worse. Another risk factor of high blood pressure is sleep apnea. Obstructive sleep apnea is common in patients with resistant hypertension and may increase the chance of developing high blood pressure. High cholesterol. More than half of those who have high blood pressure also have excessive cholesterol. Another risk factor of high blood pressure is diabetes. The majority of diabetics also experience high blood pressure. Inadequate potassium intake. When sodium levels in your cells are out of balance, potassium helps. So, how potassium actually works? Potassium reduces blood pressure by relaxing smooth muscle cells in your arteries. Another risk factor of high blood pressure is vitamin D deficient diet. It's unclear whether eating a diet low in vitamin D can cause high blood pressure. But researchers believe that vitamin D may have an impact on kidney-produced enzyme that controls blood pressure. But find out from your doctor if taking a vitamin D supplement may be beneficial for you. Cold and cough medicines is another risk factor of high blood pressure. Common decongestants found in cough and cold medications include pseudoephedrine and phenylephrine. These drugs narrow all of your arteries, not just the ones in your nose, which raises blood pressure and heart rate. Another risk factor of high blood pressure is medicines. The contraceptive pills, steroids, and non-steroidal anti-inflammatory drugs and NSAIDs such as brufen, naproxen are among the medications that might raise blood pressure. Herbal treatments. Herbal treatments, especially those that contain licorice. Now, after the discussion about the risk factors of high blood pressure, here comes the complications of high blood pressure. Heart illness. Blood can weaken and harm blood vessels when it circulates through your body too quickly. Due to the formation of scar tissue, it's possible for debris like fat and cholesterol to accumulate. The debris may subsequently group into plaques that obstruct blood flow and cut off the heart supply of blood. Atherosclerosis is the term for this process. Cardiovascular disease and arrhythmia in angina, irregular heartbeat, or cardiovascular disease is brought on by atherosclerosis. Another complication of high blood pressure is cardiac arrest. When the heart cannot pump enough blood into the body, cardiac failure sets in. When high blood pressure causes the arteries to narrow as a result of plaque buildup or blood clotting, heart failure will ensue from atherosclerosis. This makes it more difficult for blood to circulate effectively throughout the body, which forces the heart to work even harder and may grow to accommodate demands. When these circumstances exist, the heart's ability to pump blood is reduced. Stroke. A person's risk of having a stroke is markedly increased by hypertension. This is due to the possibility that hypertension will rupture or obstruct the arteries that carry blood to brain. Moreover, a blood clot or clot accumulation from another part of the body may fragment and travel to brain, resulting in embolic stroke. Strokes can be fatal or very serious because the surrounding brain tissue may not get enough oxygen and nutrients from the blood, which results in long-term damage. Another complication of high blood pressure is aneurysm. In medical terms, aneurysm is actually an abnormal swelling in the blood vessels. An aneurysm develops when artery veins pass brought on by the hypertension filled with blood and protrude outward from the atrial wall. If these regions expand excessively, they may explode, resulting in hemorrhage or even death. Now, here's another complication of high blood pressure, and it's kidney illness. In the US, high blood pressure is second only to diabetes as a cause of kidney failure. The veins in the kidneys may weaken and narrow as a result of injury from hypertension. That's why the kidneys may find it more difficult or impossible to effectively eliminate waste and fluid from the body as a result. The extra blood pressure brought on by the fluid that the body is still unable to eliminate could lead to a vicious cycle and further damage. Another complication of high blood pressure is impairment of vision. The blood vessels in the eyes can be harmed by hypertension, much as other blood vessels throughout the body. This decreases the blood supply to the eyes, which can accordingly cause ruptures. And this is called hypertensive retinopathy. Organ vein loss due to hypertensive retinopathy and its complications is possible. Another complication of high blood pressure is peripheral vascular illness. Hypertension-related atherosclerosis can result in artery blockages or constrictions which reduce blood flow to the various parts of the body, including the limbs, stomach, and head. Peripheral arterial disease is the term for this. Some patients with peripheral arterial disease don't have any symptoms at all, while in others it causes pain and other unpleasant symptoms. Amputation, infection, erectile dysfunction, heart attack, and stroke are a few other consequences that can arise from peripheral arterial disease. Another complication of high blood pressure is cognitive impairment. High blood pressure causes cognitive impairment. A person with cognitive impairment has difficulty remembering, picking up new information, focusing, or making judgments that have an impact on their daily lives. Another complication of high blood pressure is sexual dysfunction. Some people's hypertension may have an impact on their sexual desire and function. This is due to the possibility that it will have an impact on blood flow, a crucial mechanism for sustaining arousal. For instance, erectile dysfunction might result from hypertension. It could be a factor in having a decreased libido or less desire for sex. Thanks for watching the video. If you didn't subscribe my channel, then click on the subscription button. If you want to know more about blood pressure, then click on the link given in the description below.